Hello everyone, I'm Shanmati, second MSc Applied Microbiology. I'm going to talking about HACCP, Hazard Analysis Critical Control Point. HACCP is a systematic and science-based approach to identifying, evaluating and controlling food safety hazards. It aims to prevent and reduce risk associated with the production, processing and handling of food product by establishing critical control points and monitoring procedure to ensure the safety and good quality of food. HACCP is a tool that can be useful in the prevention of food safety hazard. While extremely important, HACCP is only one part of multi-component food safety system. Implementation of HACCP along with other practice such as good manufacturing practice, sanitation standard operating procedures, a personal hygiene problem are required to ensure the success of the program. HACCP was introduced as a system to control safety as the product is manufactured rather than trying to detect problems by testing the finished product. This new system is based on assessing the inherent hazard or risk in a particular product or process and designed a system to control them. Pre-requesting program for HACCP, good manufacturing practice, statistical process control, supplier quality assurance, preventing maintenance, education and training, quality management systems, sanitary design and sanitation, good laboratory practice, good distribution practice. There are 7 discrete activities that are necessary to establish, implement and maintain in a HACCP plan, and these are referred to as 7 principles as follows. Contact a hazard analysis, determine the critical control points, establish critical limit, establish monitoring procedure, establish corrective action, establish verification procedure, establish record keeping and documentation procedure. The first principle is contact hazard analysis. The initial step in the HACCP plan to perform hazard analysis, which involves identifying and evaluating potential hazards at each stage of food production. This includes recognition, biological, chemical, and physical hazards, assessing their probability and impact, and using this analysis as basis of the entire HACCP strategy. Determine the critical control points. A critical control point is a step at which control can be applied and essential to prevent or eliminate food safety hazard or reducing it an acceptable level. A critical control point is a step or procedure in a food process at which control can be applied, and as a result, as a food safety hazard can be prevented or eliminated, reducing or acceptable level. A food safety hazard is any biological, chemical, or physical property, and they may cause food to be unsafe for human consumption. Establish critical limit. Each control measure associated with the CCP must have been associated critical limit, which separates the acceptable from the unacceptable control parameter. A critical limit is a maximum or minimum value to which a physical, biological, or chemical hazard must be controlled at a critical control point to prevent, eliminate, or reduce the hazard acceptable level. Scientific basis. Critical limits should be based on the scientific evidence, regulatory requirements, industry standards, and guidelines. Critical limits considers values factors such as temperature, time, moisture level, acidity, microbial load, and physical attribute to control hazard effectively. Establish monitoring procedure. Use a calibrate digital thermometer to measure the internal temperature of food. Place the thermometer probe in the thickest part of the product. Record the temperature reading at regular interval during the cooking process. Compare the record temperature to the critical limit 165 degree Fahrenheit. If the temperature falls below 165 degree Fahrenheit at any point during cooking, take immediately corrective action such as adjusting cooking time or temperature. Document all monitoring results, including time and temperature reading. Establish corrective action. In a food processing facility that produce canned vegetables, let's say one of the critical control points is a cooking temperature and its must specific temperature to ensure that harmful bacteria are killed. During monitoring, it is discovered that the cooking temperature fell slightly below the critical control limit for a short period. In case, the corrective action might include immediately stopping the production line, adjusting the cooking temperature to the corrective level, rechecking the temperature to ensure within the safe range, evaluating any affected products to determine if they reproduce or must be discarded. Establish verification procedure. The verification procedure as per its principles involves ensuring the HACCP system is working effectively. Establish verification procedure. Validation ensure the industry or plant companies with the required designs or plans that is they are successful in ensuring the production of safe products. Verification ensure the HACCP plan is adequate that is working in intern. Verification processes may include such activities as a review of HACCP plans, CCP records, critical limits, and microbial sampling and analysis. Verification has several steps: the scientific or technical validity of the hazard analysis and the acquiring of the CCP should be documented. HACCP system verification activities include review of the HACCP system and its record, observation of operation and CCP, asking employees questions, especially those that monitoring CCP, routine checking of monitoring procedure and equipment, review of critical limit deviation and non-conforming product handling and disposition, internal auditing of HACCP system, external third-party auditing of the HACCP system, microbiological sampling of product contact surface, microbiological sampling of the product, official evaluation of the product. Establish record making and documentation. The principle emphasizes the importance of maintaining detailed record and documentation to support the HACCP system and provide evidence of its effectiveness. Suppose a dairy processing plant has identified multiple critical control points related to the pasteurization, homogenization, and packaging process to ensure the safety and quality of the other milk product. In this case, records are maintained for each batch of milk products, including data on pasteurization, temperature and time, homogenization pressure, and packaging details. These records are regularly reviewed and documented to ensure that the critical control points are constantly met and the process are within the specified limits. In case of any deviation or corrective action is taken, detailed documentation of incident, action, and outcomes are maintained. Thank you.